Our protocol makes it possible to assess the evolution of functional independence of elderly patients during hospitalization for an acute medical episode. The ADL score is reproducible, easy to use, and can be used to diagnose the loss of functional independence at an early stage to allow adaptation of the rehabilitation care plan.
To evaluate bathing, ask patients how they bathe and whether they need someone to help them with bathing. If so, ask which part of the body they require help with, and note whether they are independent or dependent in bathing activities. Ask patients whether they can dress and undress alone, and whether they can take their clothes out of the closet without help. Then ask whether they need help with putting on socks or other items of clothing, and note whether they are independent or dependent in dressing activities. Ask patients whether they go to the toilet unassisted at home and whether they can sit down and stand up from the toilet, arrange their clothing as needed, and clean the genital area without help. Then note whether they are independent or dependent in toileting. To evaluate transferring, ask patients whether they can move from bed to chair and from chair to bed without human assistance, and note whether they are independent or dependent in transferring. Then ask patients whether they have complete self-control over urination and defecation, and whether they can use a urinary catheter or diaper without help. Note whether the patients are independent or dependent with respect to continence.